Hello friends, welcome to DentoMedia YouTube channel. We are back with a new video and an interesting topic and which is very important in our day-to-day lives, that is brushing techniques. So let's get started. Brushing our teeth is an important part of our dental care routine. For a healthy mouth and smile, the ADA recommends brush your teeth twice a day with a soft bristle brush. The size and the shape of your brush should fit your mouth, allowing you to reach all areas easily. Replace your toothbrush every 3 or 4 months or sooner if the bristles are frayed. A worn toothbrush won't do a good job of cleaning your teeth. Make sure to use a ADA specified fluoride toothpaste. So there are a bunch of brushing techniques which are there. Let's get to discuss them one by one. First is the Boss or the circular cleaning method. Then there's the modified Boss technique, the modified Stillman's technique, Fones or circular or scrub method, vertical or Leonard's method, Charter's method, scrub brush method, the roll technique, and the Physiologic or Smith method. So the first is the Boss method or the sulcus cleaning method. It is the most accepted and effective method for the removal of dental plaque present adjacent to or underneath the gingival margins. So the indications for this brushing technique would be it is most adaptable for open interproximal areas like midline diastema or where there are physiological spaces present. The cervical areas beneath the height of the contour of enamel or the exposed root surfaces. It is recommended for patients with or without periodontal involvement. So the technique is the bristles are placed at 45 degrees angle to the gingiva and they are moved in small circular motions. The strokes are repeated 20 times, 3 teeth at a time. On the lingual aspect, the brush is inserted vertically and the heel of the brush is pressed into the gingival sulci and proximal surfaces at a 45-degree angle. The bristles are then activated. The occlusal surfaces are cleaned by pressing the bristles firmly against pit and fissures and then activating the bristles. Now, the advantages of this method would be it is an effective method for removing plaque, provides a good gingival stimulation, and it is easy to learn. But the disadvantages will be overzealous brushing. Now, overzealous brushing may convert very short strokes into scrub technique and can cause injury to the gingiva. It's quite time consuming, and in certain patients, dexterity requirement is too high. So, where their manual dexterity is compromised, this technique won't be a good one. The modified Boss technique differs from the Boss technique in that it has sweeping motion from cervical to incisal or the occlusal surface. So it is a part of a routine oral hygiene and it helps in intracircular cleansing. Advantages is excellent sulcus cleaning, a good interproximal and gingival cleaning, and good gingival stimulation, but the same disadvantages, the dexterity of the wrist is quite required. So as you can see in the picture, the toothbrush is positioned on the facial and the maxilloproximal surfaces of the maxillary molars, and the palatal position you can see on molars and premolars. So it combines the vibratory and circular movements of the Boss technique with the sweeping motion of the roll technique. So it's a combination technique such that the bristles are at 45 degrees to the gingiva. So this way the gingiva is also stimulated in a good way. They are gently vibrated by brush handle in a back and forth motion, and the bristles are then swept over the sides of the teeth towards their occlusal surfaces in single motion. You swipe it off. The next technique is the modified Stillman's technique. The indication for this technique is dental plaque removal from the cervical areas below the height of contour of enamel and from the exposed proximal surface. Cleaning tooth surfaces and gingival massage. It is recommended for cleaning in areas with progressing gingival recession and root exposure to prevent abrasive tissue destruction. A soft toothbrush is indicated for this technique. Again, the disadvantage would be it's a time consuming and improper brushing can damage the epithelial attachment. So we can see the modified Stillman's technique. The sides of the brush, they are pressed against the teeth as well as the gingiva, and we move the brush with soft back and forth strokes in the coronal direction. So they are pointed apically with an oblique angle. The bristles are positioned partly on the cervical aspect of the tooth, partly on the gingiva. They are activated with short back and forth motion in the coronal direction. 20 strokes applied. Procedure is repeated systematically and you're done. The next is the Fones method or the circular or scrub method. Indications are for young children, physically or emotionally handicapped individuals, or patients who lack dexterity. So here the child is asked to stretch his or her such that they are parallel to the floor. The child is asked to draw big circles using whole arm in the air. He is instructed to draw big circles. The diameter of circles is reduced until small circles are not formed. And he is ready to make circles with the toothbrush, making sure that all the teeth and gums are covered. So quite easy to learn and shorter time. Disadvantages can be traumatic to the gingiva. The interdental areas are not properly cleaned and it is detrimental for adults, especially who use the brush vigorously. This next is the technique is the vertical method or the Leonard's method. Here the vertical strokes are used. Maxillary and mandibular teeth, they are brushed separately. So it is the most convenient and effective for small children with deciduous teeth. In the disadvantage would be the interdental space of the permanent teeth are not properly cleansed. So here the bristles, they are placed at 90-degree angle to the facial surfaces. You place them at 90-degree and you bring your bite edge to edge, means all the teeth are in contact with edge to edge. The front and especially your anteriors, you place the brush with the filaments against the teeth at right angles. Then you brush vigorously with great pressure with a stroke which is mostly up and down the tooth surfaces with a slight rotation or circular movements after striking the gingival margin with force. It is not intended that the upper and lower teeth shall be brushed in the same series of strokes. The teeth are placed edge to edge to keep the brush slipping over the occlusal or the incisal surface. The next is the Charter's method. It is basically indicated in individuals having open interdental spaces with missing papilla or exposed root surfaces, or even those wearing fixed partial dentures or orthodontic appliances. For patients who have periodontal surgery or patients with moderate interproximal gingival recession, this method is used. So here a soft or a medium multi-tufted toothbrush is indicated. The bristles are placed at an angle of 45 degrees to the gingiva with the bristles directed coronally. Then the bristles are activated by vibratory strokes which are quite mild with the bristle ends just lying interproximally. So it basically massages and stimulates the marginal as well as the interdental gingiva. And the brush ends, they do not engage in the gingival sulcus to remove the subgingival bacterial accumulations, which accounts for its disadvantages. The correct brush placement is limited or impossible to do, so modifications become necessary, which makes this procedure quite complex, and requirements in digital dexterity, they are high. The next is the scrub brush method. This method of brushing requires vigorous horizontal, vigorous vertical and circular motions. It's a freestyle brushing scene. Disadvantages: it is not very effective in plaque removal. Tooth abrasion and gingival recession are the biggest problems we're going to face with this. Next is the roll technique, rolling stroke method. It's the sweep method, works fairly well for patients with normal gingiva. So it is indicated in children, adult patients with limited dexterity, useful for preparatory lessons for modified Stillmans, since the initial brush placement is same as in the Stillman's technique. So again, the bristles are at 45 degrees angle. The toothbrush is rolled across the surface towards, you take it towards the occlusal surface. So it also requires some flexibility around the wrist. So the advantages will be it provides a lot of gingival massage and stimulation, and the disadvantages will be if brushing is carried out too high during initial placement, it can lacerate the alveolar mucosa. Tendency to use quick sweeping strokes resulting in no brushing for cervical third of the tooth, since brush tips pass over rather than into the area, and likewise for the interproximal area, and replacing the brush with filament tips directed into gingiva may produce or punctate lesions. Now, the physiological method is the Smith method. The physiological method was described by Smith, advocated by Bell later on. It was based on the principle that toothbrush should follow the physiological pathway, that is followed by food. The toothbrush should also follow the same pathway when it traverses over the tissues during mastication. So they are pointed incisally or occlusally, the bristles, and they are moved along or over the tooth surfaces and gingiva. The motion is quite gentle, sweeping from incisal or occlusal over the facial and then progressing towards the cervical and over the gingiva. It's an attempt to duplicate nature's self-cleansing and gingival stimulation mechanism during the mastication of food. So the advantage mainly here, it's a natural self-cleansing mechanism. Supragingival cleaning is good. But the disadvantages is interdental or sulcular areas, they are not properly cleansed. So that's all for this, guys. Hope you like this video. Do hit the like button, share this video, and if you have any queries, put it up in the comments. I am happy to answer them, and don't forget to subscribe to my channel DentoMedia. Thank you so much.